So friends, today we are again going to talk about varicocele. So we have a very good patient. Uh, he has come a very long way from Somalia, from Africa, and he's an engineer, and his wife is a doctor, and they were having a problem of varicocele, which was not letting them have a family. There were a lot of problems in the sperms. So there was no motility in the sperms. The counts were also falling. So they came to me, and today we have done a microscopic varicocele ligation for them, and we've used the Doppler also to identify the artery. So they had also come with the expectation that they will get something which is of an international standard at very reasonable prices, basically. And let us know from the patient, exactly what the problem was and how he felt after the problem was corrected, and what was his journey through the surgery. So, sir, welcome to India, and it's a pleasure to have operated upon you.
Thank you, doctor.
And a colleague has trusted us with her husband, and it's a big thing. I appreciate it.
Yes.
And sir, I just want to know what was the problem because of the varicocele that you were facing.
Firstly, my wife diagnosed that there is a problem in my scrotum area. She said, I think this is a problem. You have to go to the nearest doctor. I consulted a urology doctor in Somalia. He said, you have grade 2 varicocele. And I searched online, anything I can do it. I get India. It's the best for these options. And also I got Dr. Rahman saying why varicocele microsurgery is the best option, even for the doctors. That's why I come a long way from Somalia to here. And thankful, alhamdulillah, I'm finally here. Dr. Rahman consulted me automatically to go the surgery, and I got the surgery. Alhamdulillah, I'm very satisfied. And doctor also uses high technology procedures like microvascular. That's why me and my wife advised me to use this procedure, because microvascular Doppler can identify everything. That's why I use it. And I searched many centers in India. I got this center, Eurocenter, is the best for microvascular.
Thank you so much. I appreciate that.
That's my honest review. I'm not making anything.
So basically, sir, when you went inside the operating room,
Yes.
Many patients, they are fearing surgery because of one, they feel that, there'll be a lot of pain.
Yes.
And the second reason that they fear surgery is they think there'll be a lot of complications,
Yes.
It will be very difficult. And then they also fear after the operation, recovery will be long, and, it will be a lot of wastage of effort, job, all those things. So on these regards, when you went to the theater, what did you feel? How was the operating room?
Firstly, I get conscious what will be the surgery. But my wife is a doctor. She said nothing to worry. And there is another doctor, Dr. Rahman, and my wife. I have two doctors. I don't have to worry much about the surgery and the procedure. And the recovery, inshallah, will be better.
So did you feel any pain during the entire process?
I was watching the procedure, everything, every bit by bit, every procedure.
So basically, what did you see when you were watching the procedure on this big screen?
Yes.
What all could you make out?
I was seeing ligation from the arteries from the vein. I'm not that much in medical.
I appreciate that.
I know what difficulty that doctor is doing to get this procedure done. Thank you, doctor, again.
So you feel that basically it was a technically challenging procedure.
Yes.
And you could also see those separately, your vas, the ones which carry your sperms.
Yes.
You could see all your veins.
Yes.
You could see your artery.
Yes.
The Doppler.
The Doppler identify every time.
Yes. So every time we were cutting anything, we were making sure that it is not the artery.
Yes. No mistake.
Right. And you also saw that there was only one artery. Right? In your case.
Yes.
In many patients, there are 2 or 3 arteries also.
Every other is gone except one artery.
Right. And one lymphatic also.
Yes.
Yeah, you saw there was a vein-like thing which was very clear, transparent like glass.
Yes.
So that was the lymphatic.
White liquid.
Right.
Yes.
So basically, you enjoyed the process as such?
I enjoyed. I
Okay.
enjoyed 100%.
Okay. And basically now it's been after the surgery. Are you feeling any discomfort,
No.
any problem,
No,
any other scares that you have, any other fear that you have?
no. My satisfaction is come from the doctor. If you are happy with your doctor, you don't worry about the procedure and the recovery time.
All right.
Thank
So
you.
so basically, just again, I want to explain to you the recovery process further,
Okay.
because this is a doubt of many people. So all viewers now understand that this is a very small process. It takes
Yes.
about 1 to 1.5 hours.
Okay.
It's done completely under the microscope. We identify each and every structure. We
Yes.
save the vas deferens, which carries the sperms. We save the artery. We
Yes.
save the lymphatics. And basically, after the surgery, there is only one self-dissolving stitch.
Yes.
And what is the length of this incision that you saw?
Small. You don't imagine it is happening.
So basically, it's like a hole. So
Hole,
if
yes.
I showed you in front of my
Even
little finger.
smaller than the little finger. Yes.
Yes, so it is smaller than the little finger
Yes.
also. So it's about 5 to 6 mm. Actually,
Yes.
it's like a hole. So now this only one single stitch is there. It will dissolve on its own. We have put a very small dressing, as you can see there.
Yes. Yes.
So what you have to do is you have to start taking bath after 5 days, 4 to 5 days. And you have to wear the scrotal support, the tight underwear that we've requested you to wear.
Yes.
That's for about 6 weeks, 4 to 6 weeks. You can do all your activities. You can walk, you can brush, you can do all the work from home thing. You can type on your
Yes.
computer, everything you can do. But you will not be able to lift heavy weights for
Yes.
another month.
Okay.
Also, intimacy also again for another month you have to avoid. And basically, you can start those cycling and all those light exercises by about 2 weeks.
2 weeks.
But again, heavy weight lifting, we do not want you to do for the next 4 weeks.
Okay. Thank you.
So, and the changes in the sperms, you should be able to start seeing by 3 months' time. And usually by up to 1 year, you will be able to realize the full potential of your sperm. So whatever damage the varicocele was causing,
Yes.
that will all be corrected by about
One
a year.
thing. One thing I forgot is even first time we got consultant Dr. Rahman, he said there is no need DFA test.
Yes.
Thank you.
So my pleasure.
Yes.
So basically, since we know that these kind of things are
Yes.
direct implication of varicocele, we can
Yes.
save a lot of unnecessary tests.
Yes.
And we can confidently go for the process. And as you
Yes.
know, it's not a very big deal. It's a simple process.
Yes.
And it requires high technology. And we've been doing it for so many years now. So I wish you luck and
Thank you, Doctor.
good health.
Thank you.
And
Appreciate it.
And we'll be in touch.
Inshallah.
And
Soon.
we'll see more patients from your country as well.
Yes. Yes.
Okay.
I highly recommend it, Dr. Rahman Tanwar. Thank you, Doctor.
Thank you. Pleasure. All the best.
All the best.